Thank you, Mr. Chairman, and I want to thank all of our witnesses today. I've sat here and listened today about the back and forth that if you want to open up schools safely, clearly you don't value in-person learning. Let's be clear. We totally agree and honor and respect and need to have students in the classroom learning one-on-one or with a teacher. That is the ultimate goal, but we also need to do it in a way where we do not needlessly risk lives. And Dr. Schwinn, I applaud your commitment to opening schools. I find it a little odd that you're not acknowledging the necessity of federal support to be able to do so. I represent the state of Nevada. We've seen a $1.2 billion shortfall, likely cutting over $156 million in K-12 funding. And so we know that whatever option that we're looking at, and a lot of them aren't great options, that we need, will require additional resources. And honestly, to me, it requires extensive testing. And I want to point out that in Tennessee, you are one of 9 states that has more than double the testing needed. That's been estimated by 3 public health organizations that would be needed to control your outbreak. And the fact that Tennessee basically fronted the cost of this test so that anyone who wanted it could get it. Tennessee officials now acknowledge that they are hoping and they're banking on the federal government paying for those tests. So to me, the lack of testing in this country is number one, why we have rampant unemployment, but number 2, why we are faced with this awful decision on how we reopen schools, whether we treat our students and our teachers like guinea pigs by rushing to open our schools without proper resources, or we keep trying to do remote learning, which we know does not do our families and our students the justice that we deserve. Dr. Hinojosa, I wanted to ask you, you're in a predicament quite like the one we're in Nevada, where Dallas is facing an issue of nearly $33 million in lost revenue, which is certainly going to impact your schools. Can you tell Congress and tell us how we can best address these revenue shortfalls and, how we can best help you in your ability to reopen in the fall?
Yes, for us to be open, for our biggest ask right now is to make sure that we have broadband connectivity and devices so that we can connect with our families. And also, we do have the PPE, so we're good on that kind of information, but we need a lot more support going forward with how our special needs students get supporting. And Title I is so critical to us. 92% of our students are economically disadvantaged. And also the big funding that comes from the Department of Agriculture for feeding our students. We feed all of our students 2 meals a day. And it is just extremely important that those opportunities continue for the long term. And then also the state took a lot of our money through the CARES Act to supplant the revenue that we get. We understand why they did it, because they have significant shortfalls. So they did that to shore up this year, but that's only this year. Going forward, there's going to be huge deficits in state budgets. And so it is a domino effect that will trickle down to every community in the state of Texas if nothing is done about it.
Have you estimated what you plan to receive from the HEROES Act, and what's the delta between what you would estimate that you're receiving and what you actually think you need to open safely?
No, there's a lot of nuance in that, because under the CARES Act, we thought we were going to get 61 million. We actually got 31 million. But from the HEROES Act, we haven't fully analyzed that. And there are several other bills in front of Congress that can help us with connectivity. So no, we haven't done that analysis yet, but it would be significantly helpful for everybody in Texas.
And then finally, I think we're running out of time here. Can you just walk us through what you've gone through with your local public health officials to talk about the public safety with respect to your reopening plans?
Absolutely, we're in constant contact with our local health officials about what is they expect from us, what we need to do to make sure that we have everybody safe, distancing, masks, shields, buses, entryways.
Thank you.
Every item we've discussed has been considered with our local health officials.
Thank you. Thank you very much.
Thank you. I yield.
I now recognize Ms. Shelley.